I will call to order Petersburg Borough special meeting of November 5th, 2021. Will the clerk please call the roll?
Bob? Oh, you're muted,
Here.
Bob. Thank you.
Okay, here.
David,
Present.
Jay,
Here.
Thomas,
Here.
Jeff,
Here.
Mark,
Excused.
Chelsea.
Here.
Thank you.
For those of you listening, we have 6 members present with Mayor Jensen excused. In chambers are myself and member Fine Walsh, and online we've got member Lynn, member Mucci, member Tremblay, and member Kensinger. So with that, I would move on to item 2, approval of tonight's agenda, which is just one item. I would entertain a motion to approve this.
So moved. Second.
Motion's been made by member Mucci and seconded by member Kensinger. All those in favor say aye. Aye.
Aye.
Aye.
Any opposed? Most excellent. The agenda is approved unanimously. Item number 3 on tonight's agenda is persons to be heard related to tonight's agenda. Clerk Thompson, I will defer to you to, if there are any members in the queue, and if so, you proceed at your leisure. Oh, and before we go any further on that, I apologize. For those participating in the visitors' views related to the agenda, I know it goes without saying, we won't be targeting or calling people of the assembly by name. We ask that you speak civilly and respectfully, and we've done this many times, so I don't think it'll be an issue. If on the off chance it is, your mics will be muted, but again, having navigated many meetings with the citizens of Petersburg, I don't see that being an issue this evening. With that, I'll turn it back to you, Clerk Thompson.
Thank you, Vice Mayor Stanton-Gregor. We're going to allow any doctors that have called in to speak first, as they are very busy at this moment. So I do see Dr. Burt on the line, and go ahead, Dr. Burt.
Thank you.
There you go. Can you hear me?
Clear as day.
Perfect. I just wanted to say that I am in support of the ordinance to require masking within all public buildings within the borough for the parameters, the time parameters noted in this ordinance. That's it.
Thank you so much, Dr. Burt. Appreciate it very much.
Okay, and let's see. Do I see any more doctors on the line? Let's go ahead and allow, I'm sorry.
I'm sorry. Can you give me the call-in number? Our physicians are not able to call in with the attachment that was given. So is there a number they can call in?
Clerk Thompson, go ahead. That'd be great.
Yes, I'm not exactly sure which number is the best number. Tell them to try 1-253-215-8782. The webinar ID is 819-7738-9212. And the passcode is 114228. Phil, if that phone number isn't the right one, I have more we can try.
Okay, I sent it. Thanks.
And while that's getting sorted out, so one other brief moment of business is ordinarily we have a time requirement of, it'll be 24 hours and today 1 hour before meeting to have people register with Clerk Thompson or enter the queue. But this special meeting with importance to the community without objection from the assembly, I would like to waive that and allow Clerk Thompson to entertain calls as they come into the queue during visitors' views. Any objections to that this evening?
No.
All right, most excellent. Thank you. Anyway, Clerk Thompson, it's all you once again. Just wanted to get that on the table.
Thank you. Let's go ahead and allow Jennifer Briner to speak next so she can get back to what's important.
Can you hear me?
Clear as day, Jennifer.
Oh, great. I don't have anything prepared, but I would just like to say I support masking in public buildings in Petersburg. I think we've seen time and time again that gatherings that occur with very strong mitigation plans are very low to no transmittal rate. And I think we're clearly seeing that when people gather without mitigations like masking, that the spread is rapid, and we are in the middle of a wildfire, it seems. So I strongly support masking in borough buildings, and strongly support or encourage people to be careful where they go, who they're around, and please mask. And I guess that's all I really need to say.
Thank you, Jennifer. Much appreciated.
Okay, and now I don't see any other doctors on the line yet, but I do know that Erica Klunt Painter is up at a conference, and we'll let her speak next.
Sounds wonderful.
Thank you.
Okay, can you hear me?
Clear as day, Mrs. KP. The floor is yours.
All right, great. Thank you so much. So I do want to thank the Petersburg Borough Assembly for the work you are doing. I know you truly care about our community, schools, businesses, and medical facilities. Your work on the Assembly is often thankless and challenging, and I appreciate you taking the time to consider a community-wide emergency mask mandate during this current spike in COVID cases. As some of you know, the schools are nearly at a breaking point right now. Our administrative and office staff are spending the majority of our time testing, making phone calls to public health, taking phone calls from public health, sending letters, fielding phone calls from frustrated families, dealing with sick students and staff members, and still trying to provide quality instruction to our students who are in the classroom learning and students who are out of school in isolation or quarantine. We are literally killing ourselves trying to implement mitigation measures to keep our students safe and in school, maintain extracurricular activities, and provide a consistent education for all. In the past 24 hours, we have done 145 antigen tests in our schools, K-12, all negative, I am happy to report. We will continue to do whatever is needed to keep our schools open, but we are fighting an uphill battle when there are few mitigation strategies being followed in the community at large, even when we are in the midst of multiple positive cases nearly every day. We do understand that people are going to get COVID and that we are all going to be learning to live with this for the coming future. People intentionally ignoring quarantine and isolation rules, going to work and school with symptoms, gathering in large groups with few, if any, mitigation measures is pulling our schools under. We have 430 students and 85 staff members with families and multiple community connections. We are absolutely connected to every agency, organization, church, and business in town, and we are being severely impacted by community decisions and actions. We do not want to close our doors or cancel more activities for our kids. Visiting schools are not comfortable or even allowed in some cases to send their teams to our community with this level of spread. We have already canceled a large volleyball seeding tournament scheduled for this weekend due to these concerns. In addition to the missed opportunities for our PHS students, it is also a missed opportunity for our local businesses, as 90+ students and coaches would have been staying in hotels, ordering from our restaurants, and spending money in our stores. I know you don't have all the answers and can't fix this problem entirely, but it is frustrating to think that our schools may be closing their doors while bars, churches, and large social group gatherings continue unchecked. Schools are not considered large areas of spread with the layered mitigation strategies in place, including testing, but we do not exist in a vacuum. As we have been required to identify close contacts in school this year, I am pleased to report that no student we have sent home for school exposure has tested positive so far. In short, we are impacted by actions inside and outside our walls, and we can't carry the burden of mitigation alone for the entire community. Masking is a small sacrifice we can all make to keep our schools open, our hospital running efficiently, and our businesses running. Let's take care of each other. Thank you for your time.
Thank you, Erica.
Okay. Dr. Heyer.
I was just alerting the clerk that one of the doctors is having a hard time getting online, so just bear with us as we try to navigate this for a second. Go ahead, Clerk Thompson, you look like you want to say something.
Sure, if Phil or Dr. Heyer can hear this, let's try this next number, which is 1-346-248-7799. Same webinar ID and passcode.
Can you try that again? Sorry.
Sure, no problem. 1-346-248-7799.
Okay, we'll try that.
Okay, in the meantime, let's see. I have some more people waiting to talk. Let's go ahead and hear from Dana Tinas.
Okay, got it. Can you hear me now?
Clear as day, Mrs. Tinas, the floor is yours.
Excellent. So what could be better than a mask? An immune system upgrade. Did you know that if your vitamin D level is sufficient, you most likely will not end up in the hospital? Most people are deficient in vitamin D. Vitamins A and C, as well as lysine, an amino acid that tamps down shingles and herpes virus outbreaks, are necessary for good immune function. These actually assist your body in keeping sickness at bay, unlike the diaper on your face approach, which traps bacteria. Another thing masks can't do is actually stop viruses. There is no debate about this. But did you know you can help prepare yourself to face viruses with zinc and the over-the-counter supplement quercetin? Zinc limits viral replication in your cells, but your cells don't absorb it easily. That's why supplements like quercetin and medications like the much maligned hydroxychloroquine and ivermectin are so useful. They enable your body to pull zinc into your cells, and they have anti-inflammatory and other properties useful against viruses. They can be used prophylactically as preventives as well as for treatment in the early stages of COVID. Masks are not actually protecting anybody, but they are causing great psychological harm, especially to children. And this is information a friend and I tried to share a year ago in a commentary on KFSK, but the station refused to air it. They would not tell us why. That was the first, but not the last incidence of censorship I've experienced in Petersburg. If the borough is concerned about health, and I believe they are, and minimizing the impact of COVID, I suggest they do what the state of Uttar Pradesh in India has done, distribute packets of supplements and medicines here in town for early at-home treatment. Thank you.
Thank you for your testimony, Mrs. Tinas.
Okay, let's go to Joe Bertignoli, please.
Am I being heard?
You're being heard loud and clear. Proceed, sir.
Hello, folks. Thank you for doing this, and appreciate all the work you guys do, of course. But and I don't usually speak at these things, but I felt with what this is and what's going on, when I heard it, I felt the need. I just had to put my support in here for the passing resolution 2021 there, ordinance -19. I feel it's a small sacrifice and a small price we can pay for trying to get this thing under control and keep people safe. I was just recently down in the other world in Seattle, and it didn't seem to be a problem for anybody going to any store to have a mask on, and even people on the streets were wearing masks. So it's I know it's a different world down there, but people didn't balk at wearing masks. In fact, I went into a store without a mask, forgot it in the car, and I got past the doorman or what he said, and I just was standing there waiting for my wife, and I heard this and I heard it again. I turned around and he pointed to his face, and I said, "Oh man, I forgot it." So they're enforcing it down there too. The retailers are enforcing it, that if you don't do it, and in some stores they're limiting the amount of people in there. We don't quite have that problem yet, but I just want to keep up the good work, and I want to keep the schools open. I want people that, to enjoy life, but yet I want everybody to be safe. And I think this is, again, a small price to pay for continuing on in some sort of normalcy that we have. And just reiterating what Erica Clute-Painter says, this is something we can do as a small gesture. And I think it's up to you folks to step up to the plate and say enough's enough, and let's mask up for a couple of weeks and see if we can get this under control. So thanks a lot for listening, and good luck, guys. It's a tough job you got, but you're up to the task, I'm sure.
Thank you for your testimony, Joe.
Okay, and we have Dr. Heyer on the line. I will unmute here.
All right. Can you hear me okay?
Clear as day, Dr. Heyer. The floor is yours.
Wonderful. Thank you. Just wanted to speak again in favor of this resolution. We're up to, I think, 64 cases as of 10 minutes ago. And it's not just cases, it's sickness. This is much more aggressive. We're seeing younger people get sicker. People in their 30s and 40s getting much sicker than we did when our last wave hit a year ago about. It's very quickly overwhelming the resources that we have here. We're up for it and we're doing it. But this would definitely help cut transmission. What we're seeing are a lot of these clusters where it has started in our community are in unmasked indoor space gatherings. I think our kids are suffering, and I think that adults are getting to go and play and do their thing, but it's the kids and the vulnerable in our society who are suffering. And I don't think it's too much to ask for us to wear masks for a couple of weeks for the kids and the vulnerable people in our community. Thank you.
Thank you for your testimony, Dr. Heyer. I know you're busy.
Okay, let's let Heather Kahn speak next, please.
Good afternoon. My name's Heather Kahn, and I'm the principal at Stedman Elementary. This week's been really a very challenging week, and today we ended with 76 students absent. That's not all due to COVID. There are travelers. But when we have a total of 206 enrolled, it makes a huge difference that 76 are absent. At the elementary level, we're seeing very little spread in the school due to our protocols, I believe. And the absences are impacting our students extremely. I would like to advocate on behalf of our children. We need our students in school and present physically, and this situation is impacting our students and their education right now. My days have been spent testing students and families when I would love to be doing my job in supporting families, staff, and students. I can't do this right now as the expectations of my job and what is happening in our community are requiring hours beyond which I have. Thank you.
Thank you for your testimony, Ms. Kahn.
Okay, and then we now have Dr. Hess.
Hi, this is Courtney Hess. I apologize. I haven't heard what's already been said because I was in a patient room, but I just wanted to real briefly, thank you for reconsidering a masking mandate. I think that anything that we can do to try to slow things down here right now can be helpful. And I think we're at, somebody's probably already said, but we're like right about 60 cases right now. And so this is kind of one of the biggest peaks that we've experienced here locally. And it is absolutely putting stress on our healthcare system. We're all being pulled to focus on COVID again, instead of doing routine healthcare. Just like Heather was just saying, getting pulled from our regular jobs to focus on this again has really been difficult. And what's more difficult is just seeing how many families are being impacted, pulled from school, pulled from work, and some really sick people. So definitely stress levels are up here. And I think that if we can increase our mitigation for a little while again and go back to masking and really encouraging that again, that we know that it works, it has helped, and it's helped. We see in other communities where it really has helped. So I encourage that you support the idea that we can go back to masking for a little while and try to be proactive again so that we can get back to doing what the rest of the jobs that we all like to do.
Thank you for your testimony, Dr. Hess.
Thank you. Let's see, we will. Yes, Brittany Collum, please.
Hello, can you hear me?
Maybe a tad louder. I can hear you, but maybe just try a tad louder.
All right, can you hear me a little better now?
A little better. Getting there.
A little better?
Yeah, we can
Getting
hear that.
Okay.
Yep, that'll work.
that
The floor is yours.
Oh, okay. Thank you. I'm sorry, I'm on my cell phone.
No worries.
Hi, thank you. Just calling in regarding the mask mandate, obviously, I guess. I am not in support of it, and I've called in before, and so have a lot of other people in town, mainly with the idea that it's government overreach, and it's not up to the borough to tell us what we can or should not be putting on our faces or what health decisions we should be making. We can listen to the healthcare professionals. We can make our own health decisions. We don't need the borough to be stepping in and making those decisions for us. It should be up to the businesses. It should be up to the individual people to decide what's best for them and their families. And it shouldn't be an outside entity doing that for us. It's wrong on many levels. And while there might be good intentions behind these mandates, it's not correct. This is still America. We are still allowed to make our own healthcare choices. And in my findings and many other people's findings, masks are not a good choice. Like it's been mentioned already today, there is bacteria on those masks. People are putting them in their pockets. They're touching them, especially little kids. They're not going to be washing their hands and changing their masks out every time they touch their faces. It's not practical. And I think we need to be looking at what's practical at this point, and these mandates aren't helping. I think we need to revisit how we're approaching COVID. People have mentioned this already, but it's not going away. And so we need to be looking at different ways to live with it rather than forcing these mandates on people, because it just divides the town. And it's really upsetting that we're even talking about it again. For me and our family, we've even talked about moving just because it's ridiculous in this town how vile and rude and unkind people have become in the name of kindness, and we should be masking and being kind and thinking of our neighbors when actually people get pretty nasty about it. And it's not right. And I want our town to be what it was before, where we're coming alongside each other and helping each other and not ostracizing each other because of the health decisions we're making individually. So I guess that's all I wanted to say. I hope you guys listen to all sides of the town and what we're thinking and feeling and what it's actually like for those of us that are trying to work and trying to live. It's just really difficult to see what's happening. So anyway, that's all I have to say. Hope you all have a good afternoon and good luck with your decision making. Thank you.
Thank you for your testimony, Ms. Collum.
Okay, and next we have Rick Dormer.
Hello, can you hear me all right?
Clear as day, Mr. Dormer. The floor is yours.
Awesome. Well, thank you again, Assembly members, for the hard work you're putting in and listening. There's obviously differing opinions. I'm wearing the hat as I sit at my desk here. We've just battling, fighting for kids to try to keep them in school. And one of the things I do, especially in the high school, but middle school as well, is just recognize that we've got kids coming every day trying to learn, but we've also got kids trying to be part of activities. And we actually, my master's thesis on this and getting kids involved in your school. And we have around 80 to the upper 80% kids involved in school through activities, which could be a basketball game, but they could also be a robotics club that was able to just go tour our AML today. And we're trying to keep kids involved so they stay engaged in school and obviously the productive futures they can have, whether they stay in Petersburg or move abroad and get out of town. But we just really want the best for these kids, and it is a battle. And we're not talking about the testing or trying to get kids online because we'll do whatever it takes to educate them, but it feels like we're working really hard. This is just such a great example this week. We have just working very hard to keep kids healthy. We ended up canceling this volleyball tournament, which is fine. I know we're here about academics and health and safety, but that's tough. I mean, we're Petersburg Vikings. We're pretty good at what we do here. The community, I think, enjoys what we do for our kids and loves to come watch them. And then just the financial benefits of having these teams. And we had a bunch of kids and coming in, and we work really hard to keep them safe and masks on in the gym and keep them away from each other. But they also buy things in our stores and use the hotels. And that thing just wiped out. I mean, this explosion of cases is very frustrating. And again, I apologize to be heavy on activities because we are here for academics, but both are being really shut down. And it's just been a struggle. Personally, I taught a full teacher schedule today, my first time in my 13 years as principal, and I'm happy to do that. But it's a bummer because then the principal job doesn't get done, and some of the support, as Ms. Khan said, we just want to talk about student learning. And all we do now is worry about student health, which is, of course, the top priority, but pushes academics and activities to the bottom. So thank you, Borough, for considering this mandate in some ways, just to try to keep, from my desk here, to try to keep our kids and their families as healthy as possible. Really appreciate your time.
Thank you for your testimony, Principal Dormer.
So I believe that's all we have in the queue. There are a couple other names and phones on here, and if you do want to speak, please raise your hand so that I know. Let's wait for a second here.
Absolutely. We want to make sure people have a chance to participate if they'd like.
Okay, we do have Carol Candle who would like to speak. I will unmute her now.
I'm glad we waited.
Hello, everyone. I'm recovering from COVID. I was vaccinated, but I was waiting for my booster, and I let my guard down and didn't wear a mask in a couple of situations, and I'm assuming that's where I picked it up. And thankfully, I've been able to have the antibody infusion and am feeling quite well, although my voice doesn't sound real good. So, but an interesting thing that I wanted to say is that the day my symptoms started, about a couple hours before my symptoms started, I had a haircut, and we were both wearing masks, and I was concerned when I found out I had COVID, and I contacted her, and she just told me yesterday that she's had 2 negative tests. So I was just really tickled that I was in such close contact with someone at a point where I'm sure I was very contagious, and she didn't get it because we were masking. And I just, for what it's worth, I just wanted to share that. Thank you.
Thank you for your testimony, Ms. Kendall, and I hope you continue to recover quickly and efficiently.
Thank you.
So no one else has raised their hands, and we have no new callers logging in. So I think we're done here.
Okay. We'll move on to the next item. Thank you to everyone for your testimony this afternoon. Okay. Brings us to item 4, new business. Item A, our only item, ordinance 2021-19, an emergency ordinance implementing a public health and safety measure, requirement of face coverings in indoor public settings to address current community COVID-19 outbreak. One and only reading. If adopted, ordinance 2021-19 will require masks or face coverings to be worn indoors in any building within the borough that is open to the public. I would entertain a motion to approve.
So moved.
Second.
The motion has been made by Member Kensinger and seconded by Member Tremblay. And with that, I will open the floor to discussion from assembly members. And before I do that also, I believe Phil Hofstetter, and is Dr. T on there as well today, Clerk Thompson?
Gosh, let me look if he's on this other list, maybe. No, I don't believe so.
Okay, well, for the assembly members, Phil Hofstetter is here if we have any to answer any questions if we have them, so feel free to address them to him if you do. Otherwise, the floor is open for discussion.
I'll go first.
Member Tremblay starts it off. There you go. Thank you, Member Tremblay. The floor is yours.
Thank you, Vice Mayor. I guess I've had a few things on my mind in preparation for this meeting. One note that I thought was interesting and worth highlighting was in an email by Director Dixon. She noted that we've had multiple borough employees affected testing positive in this recent surge, but they haven't been testing positive or spreading within departments. And she credits that with the borough masking policy that's been in place, which is likely helping, along with having quite a few employees that are vaccinated, which also helps. Another thing that was of interest to me was in an email we saw from Dr. Hofstetter, that there's yet to have any cluster associated with events that have strong mitigation measures, whether that's masking or being outside and well ventilated. And so I think that that's really worth considering, because to me, this is it's a real shame we're having to talk about this again. And a lot of it is because people didn't do what we know helps. People have been crowding inside and not masking and acting as if we're in the before. And considering that we've basically had consistent community spread for a month or so, we knew that that wasn't the case, and people decided to behave, I guess I'll say, irresponsibly. And so now it's time for us to get together again as a community and mask and do what we have to do so that we can put this behind us. I think the schools need it. I know the hospital needs it. And so for all those reasons, I'll be voting yes. And I'll cede the floor.
Thank you, Member Tremblay. Member Kinsinger, that you raising your hand or is poking your phone there?
Both. I'm turning it on.
Okay, the floor is yours.
Okay, thank you, sir. I've heard the statement a lot that we have to learn to live with COVID. And I think part of learning to live with COVID is when we have an outbreak that we're going to have to mask up. I think it's just that simple. I think it's a very small request to ask members of the community to put on a mask when they go into a building. Right now I'm down south. I'm traveling in an area of Oregon that's very much anti-masking, but it seems like everybody's wearing a mask down here. So I don't know why we can't do that in Petersburg. I think it's a simple thing to do. I think we've heard testimony from the hospital and from the schools, and that both those organizations are at the breaking point. I think it's going to be very selfish for us as a community if we do not pass this ordinance as an assembly, and if people actually follow it. And that's the thing that I'm concerned about. I know a lot of people don't want to wear a mask. Guess what? If you don't want to wear a mask, that's fine. Most of the stores, most of the things that you can do in town, people are making accommodations so you don't have to go inside. So just please don't go inside if you don't want to wear a mask. That's all I'm asking. And then hopefully in another week or so, hopefully not longer, we'll be past the spike in cases and we can go back to how we were somewhat before. But I want to caution everybody that this is going to be with us for a while. Until everybody gets vaccinated, we're going to keep on having outbreaks of COVID. So we're probably going to have to come back and revisit this periodically. Hopefully it's not on a frequent basis, but I'm afraid this is a trend. So I think we just have to get used to it, and I will definitely be supporting this. Thanks.
Thank you, Member Kinsinger. Member Lynn, Member Tom, Member Fine Walsh, or Member Mucci, any of you so inclined to jump in right now? Oh, there you go. Member Fine Walsh. 1 second, Member Lynn. Member Fine Walsh is ready, and you're on deck.
Thank you. When I ran for this position, I made it quite clear that I would heed the advice of our medical professionals, because they're at the front lines and they're in the best position to really guide our community through this situation. And, you know, in what I've seen prior to this meeting and through the testimony that we've had from medical professionals during this meeting, it's clear what we need to do. It seems like masking is an obvious, you know, response to this situation. Obviously not a perfect response, but that's, you know, what we need to do now. And it's a very small sacrifice. You know, I think considering what we've heard, you know, is going on in our schools and in our hospitals, as Member Kensinger said, it would be incredibly selfish, you know, to let members of our community suffer like this and do nothing. So I think we all need to kind of work together here and see if we can get through this. And while masks are a small sacrifice, I also recognize that this is in many ways a tremendous sacrifice. This is, you know, as someone has said, this is so depressing to be talking about this now over a year from, you know, I can't even remember when we weren't talking about masks. So, you know, I recognize that this is unprecedented. It's a small thing and it's a big thing, but I think we need to do it. So I'll be supporting this resolution. Thank you.
Thank you, Member Fine Walsh. And Member Lynn, the floor is yours, sir.
Thank you. I don't know if any of you have spent much time at the hospital recently, but I've been around there a few times. And I can tell you those folks are getting very weary over there with everything they have to do. And the unfortunate part is that we're having to set back some of the normal things that really have to be done to prioritize COVID. To me, all we have to do is to back up a little bit. If we were to mask and do some things that are really necessary to keep our kids in school and the businesses open, I think we can get there. And I do happen to agree with Member Kensinger is that this isn't going away. We're going to have to figure out how to live with this for the longer term. And I think we're onto that path, but it's going to take a while before it all sorts itself out. Thank you.
Thank you, Member Lynn. Member Muti, that looks like you're reaching to unmute yourself. So the floor is yours if I'm reading that correctly.
I am, Jay. Thank you, Mr. Mayor. Yeah, I'm going to support this ordinance. Unmute you. I just spent the last 10 days traveling through the Grand Canyon, Navajo Nation, Moab, Bryce Canyon, Zion this morning, and everybody's wearing a mask. I heard nobody complaining about wearing a mask. They understand that they want to get out and enjoy life. And a mask is a simple thing to ask when you're traveling in a group. Doesn't seem to be a big deal to people who want to get out and enjoy life. You know, when we first started talking about this emergency ordinance, you know, I asked some questions about, well, what are our options? Could we close businesses down or close churches down or close bars down? And, you know, the answer was yes, we could do that. But I'm not in favor of that. I'm in favor of keeping everything open as much as we can and requiring people to wear a mask when they go into a public space or a public building. This gives the business owners an opportunity to put a mask mandate in their business if they don't want to have people coming into their businesses without wearing a mask, and those folks shouldn't go into those businesses. I mean, for me, it's a simple thing. I mean, I read all the letters that we've gotten today and yesterday, and the one that I go back to that really struck home is that this person said that I was hoping that the community would do this. I was hoping the community would do that. And I have the same thoughts. I was hoping that everybody would want the schools to stay open and business to be as normal as possible. I mean, we heard from the school district about extracurricular activities. And yeah, that's a big deal to the local businesses in town. I'm hoping that if we get this in place, we'll have it on the agenda for the meeting of the 15th. In a week and a half or 2 weeks actually from today, and you know, get an opportunity to revisit it, see how we like it, see if we need to change it. But yeah, we need to kind of buckle up and do this. We had the opportunity to listen to people say, yep, they were going to do the right thing. We've all heard the stories about people having COVID parties at their house, sending their kids to school sick, trying to doing herd immunity, this, that, the other. I'm not in favor of that. I'm for listening to Phil and the medical professionals at PMC and doing what I am asked to do in my limited capacity. And I know it's uncomfortable for people to wear a mask, but like Member Kensier said, if you don't want to wear a mask, don't go to town or hang out with people. Stay home, write it out. If I go downtown, I'm going to wear a mask. I'm going to be leaving here in a couple days, and everywhere I go, I'm going to wear a mask. And it's, you know, it's a little uncomfortable, but you know, that's just the nature of the way things are. And I am fine with doing it just to kind of get through this process. So yes, I will support this. While it's uncomfortable, I think it's one of the things that the assembly can do, and I think we're headed in the right direction. So thank you very much.
Thank you, Member Amici. Before I flip it back to see if any other members of the assembly wanted to chime in and add anything further, you know, we heard from the school district, Erica, KP, Principal Dormer, and Principal Khan, and others about how this current outbreak has impacted the schools. And we've heard from some of the doctors, and they've voiced their support for this. I think before I go any further, I wanted to pause and direct a question towards Dr. Phil Hofstetter, you know, CEO of the Petersburg Medical Center. Phil, it's more of a broader question, but I think it's important for us as the assembly and the general public listening at home to hear is kind of broadly speaking, how has this current outbreak impacted PMC staff and your general organization? If you could speak to that, please, because again, I think it's important for those of us who aren't there every day to know.
Yeah, I mean, just to be direct, it's brutal. There's no other way to put it. Staffing is thin already, and then every time we have an outbreak, I haven't had an outbreak where someone doesn't walk. So, you know, it's tough. We've actually had to reach out and ask for emergency help with FEMA and nurses to come in potentially. I mean, we're asking people to, you know, step out of their box and test like crazy, you know, testing the community. We barely have supplies for rapid. We burned through so many of them. And then seeing the school, I mean, the school teachers and administrators are testing, and they have the 10,000 yard stare, you know. I mean, it's incredible. And for what, you know, it's really frustrating to see, you know, staffing just get burned out. So difficult, so challenging. And, you know, masking is, you know, is it 100%? No, but it's just a small step in the right direction to be able to address it. And it's effective. It's very effective, you know. As Member Tremblay mentioned, it's something that, you know, when we look back in time, we don't see clusters with events that are properly mitigated. So it's really obvious. It's real clear. You know, everyone's real weary. There's no one more weary than our physicians and our nursing staff, let me tell you. So, and now the teachers, seeing them and the kids, you know, going through this, it's really difficult. And I want to get on the record and really just commend not just our staff, but the school administrators and the teachers for doing what they're doing. They're doing some pretty incredible stuff. They're testing every day to get the kids in school for in-school learning. It's just, it's pretty incredible. So anyway, those are my thoughts. You know, thank you for your support.
Thank you, Phil. Appreciate that. Anyone else on the assembly care to chime in again at this point? All right, fair enough. I'm gonna just offer a couple thoughts on this for whatever it's worth. One, thank you to all of those who called in today. I know it was a short notice emergency meeting, and I always appreciate any and all public participation. I will actually single out the doctors and thank them specifically because they were still working and popping in between patients. And I know, as Phil said, just how busy they are. So I genuinely appreciate that. I'm going to jump around on a couple thoughts on this. Out of the gates, I'm going to vote for this. It's a no-brainer. I think it's important. We have to do it. I'm going to get that on the table right away. 64 cases, Dr. Heyer said, and it has increased sickness. That's a lot. That is, and more cases are coming in. I think about the way this ordinance is written. There's specific references to both the school and the hospital. Throughout the pandemic, we've often said we want to keep schools and businesses open. The borough has never made a move to shut down businesses. The state in the early stages of the pandemic, like many states did. We opened them up with mitigation strategies and they've been able to stay open throughout. Period. wearing a mask is not causing this outbreak. I'm being dramatic to illustrate my point. Wearing a mask is not closing the school. It's not limiting access to the hospital. This is one important thing that has been shown to work. I know some folks have talked about how that they're not effective in slowing the spread of the virus. Yeah, like Phil said, it's not 100% effective. But if masks were completely useless, every airline would be a super spreader event. I know it's an anecdotal statement, but it's also real. Many of us have been flying for the course of the last year. Masks didn't work or have a high level of effectiveness. Every airline would be a super spreader event. That's just real. You know, there's millions of people flying all the time and they work. And although I'm sitting here wearing one, I'd prefer not. When I travel, I'd prefer not, but it's not hard. It doesn't hurt me, doesn't put me out. In fact, it doesn't cost me anything. The mask I'm wearing right now, I grabbed on my way up right now because I left mine at my office. Oh, any place you walk into, they have masks. A couple other points. Let's see. Mrs. KP talked about some people in the community intentionally avoiding mitigation strategies. That's unfortunate. That's what's making this outbreak go further. The school and the hospital are trying as best they can to keep our kids in school and also some ability to provide medical services. I say this not as vice mayor chairing this meeting, but as a citizen, I implore people, if you are symptomatic, stay home, get tested. It works. Is it convenient? Not necessarily. Nobody wants to be sick, but please, if you know you're having symptoms or have been a close contact, take appropriate steps. It doesn't cost you anything to take appropriate steps. One thing I listened to on the radio today on KFSK and want to very publicly commend is Pastor Eric Olson from the Lutheran Church had a public service announcement out there today saying that in order to attend in-person services at Lutheran Church, masks will be required. I commend Eric Olson, member of the clergy, for looking out for his congregation. We want everybody in Petersburg to stay safe. Churches are a place where we gather in large groups to celebrate together. Let's do so safely. I encourage all members of the clergy to please, if this ordinance passes, and it appears it will, to require that of your parishioners, to keep your parishioners safe. In terms of large gatherings, fundraisers, etc., please, these are things that are important to our community. Keep them safe. These are things in our control that don't cost us anything. They keep our businesses open, keep our schools open, and they help our hospital function. The hospital workers and the school employees, these are our friends and neighbors. What we're asking is to help them, to keep our community rolling along. And the way this ordinance is written, it is set to sunset on December 6th, 2021. So it's about a month from now, and it will be revisited on November 15th meeting. We need to keep, the situation's going to be fluid. Member Fine Walsh said it very well when he said, yeah, we need to listen to the members of the medical community right now and follow their lead. I completely agree. That's who we need to be deferring to right now. And that's why we're sitting here. The school and the hospital have come to us saying, please do this. And besides us in the assembly, I'm also saying that to the general public, please follow the ordinance. Please look out for your friends and neighbors. It's the best we can do right now. And this current outbreak, as I believe it was Jennifer Briner said, it's burning like a wildfire right now. And the only way that's going to slow down is we take basic mitigation steps. I think I've probably spoken enough to it at this point, but I really want to drive home those points. And I'll open it up to any other members of the assembly if they want to chime in again. Member Tremblay, I see your hand. Floor is yours.
Thank you. I wanted to speak on two other points that came to mind as other people spoke and have been on my mind this week. From a retailer's perspective, this is an absolute nightmare time for this kind of an outbreak to be occurring. This is a make or break season, and we rely on people shopping locally to support the brick and mortar businesses that are here year round, that donate items to the fundraisers, that support the graduations of our kids, all those things. We need folks to be able to come in and shop safely. And having a mask mandate at the borough level, in my mind, empowers businesses to ask their customers to create a safe space for all of the community. So I'm hoping that retailers, all retailers, the Chamber of Commerce has masks available as well as hand sanitizer. Take advantage of those resources and keep your space safe for all shoppers. And from another perspective, something that comes to my mind is the reaction we get from people at the idea of a mask mandate, that somehow because we're passing a mandate about masking, it prohibits people from getting together, from gathering. And that's actually not true, because as somebody that organizes events, that takes a lot of pride, and I enjoy the act of bringing people whose company I enjoy, bringing them into a space and holding that space together. I believe in that moment. I believe in the power of bringing those people together. But as an organizer, you are inherently responsible for those people when you bring them together. And so by failing to provide a safe space for everybody, you as an organizer are letting them down. And so I would ask that anybody organizing events, anybody hosting, just simply follow through in hosting a responsible event that everybody can actually enjoy and not come away with a sickness that could impact them or somebody connected to them. Immediately after this meeting, I'm planning on getting together with a friend. And a few days ago, the plan was that we would go over to her house. I made a loaf of bread, they're making some soup. And I heard from her that her kiddo, who's too young to get vaccinated, was exhibiting symptoms. And instead of canceling the event, we simply are meeting outside. We're bringing our own dishes, and we're still going to be able to have that beautiful moment of connection and visitation and connecting that I know a lot of people love and have missed during the darkest times of the pandemic. And it feels so good to have these tools that can make it safe, can keep things happening in a way that doesn't detract from that moment of connection we're looking for, but in fact makes it safe to just do so. So we know what we need to do. We just have to actually do it. So I hope that people take the spirit of the events that they're trying to do and figure out how to make it happen in a way that's safe for everybody involved and that doesn't contribute to the crisis we're experiencing at the hospital and at the schools. And that's it.
Thank you, Member Tremblay. Further members of the Assembly? Fine, Walsh, anything else from you today, sir? All right, thank you all for your comments this evening. Will the clerk please call the roll?
Jeff,
Yes.
David,
Yes.
Jay,
Yes.
Chelsea,
Yes.
Yes.
Thomas, Bob.
Yes.
Thank you.
And that passes unanimously 6-0. With that, I would entertain a motion to adjourn.
So moved.
Second.
Moved by Member Mucci and seconded by Member Tremblay. All those in favor say aye.
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 Opposed?
Aye.
The meeting is adjourned. Thank you, everyone.